Hi, this is Dr. ROJoson, Director of the ROJoson PEP TALK. I will be talking on patient management process, advice to patient process. The empowerment objective for lay people is to have an understanding of the advice to patient process in the patient management process. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this pep talk on May 15, 2021 with the module on COVID-19. Second pep talk was on patient empowerment. This is my third module, patient management process. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. That is my key performance indicator. I hope you will be in my group of 30. My pep talk today is entitled Patient Management Process, Advice to Patient Process. This is the patient management process framework. There are 6 parts in the module: overview, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, peculiarities and limitations of medical practice. For today, we'll be focusing on advice to patient process. So these are the boxes that will be included. Advice is one of the basic functions of a physician during management of a patient. After the advice, if there is a decision that has to be made, and before anything is executed by the physician, there must be an informed consent given and usually officially signed by the patient. The word informed before the consent means the patient has been advised by the physician prior to the former giving the official consent. Advice is seen and expected in the following steps in the patient management. After the interview and physical examination, and after the physician has arrived to a clinical diagnosis, the next step is to advise the patient on the nature of his health problem. After the clinical diagnosis has been explained to the patient and or his relatives, the next step is to advise whether a paraclinical diagnostic procedure is needed or not. If a paraclinical diagnostic procedure is needed, the patient is informed of the various options. He is advised on the most cost-effective option. Performing the paraclinical diagnostic procedure can only be carried out after the physician has secured an informed consent from the patient. After the paraclinical diagnostic procedure has been done, the next step is to advise the patient on the results. Before the selection of the treatment options, the physician spells out and tells the patient the pre-treatment diagnosis with specification of objectives and goals of treatment. After a pre-treatment diagnosis is stated and objectives agreed upon, the next step is to inform the patient of the various options of treatment. He is advised on the most cost-effective treatment option. Carrying out the treatment procedure can be done only after the physician has secured an informed consent from the patient. During treatment, the patient is advised on the preparation, progress, outcome, and any adjustment that have to be made. And then after treatment, the patient should be advised on subsequent management, specifically follow-up. The patient should be given advice on health restoration and maintenance. I'd like to present to you my way of advising patients and relatives. These are just my thoughts, perceptions, opinions, and recommendations, and this is how I usually do it. A physician or healthcare professional deals with both patients and relatives or guardians. A successful physician-patient-relative relationship is based on the establishment and maintenance of good rapport initiated and accomplished by the physician. A good rapport basically emanates from the trust and confidence given by the patient relative to the physician. This trust and confidence can be gained by the physician through many ways. The following are some qualities of the physician that will promote trust and confidence of the patient relative. Competent physician, honest, gentle, compassionate, shows concerns, courteous, patient, persevering, and understanding. Advising patient and his relatives is a major pathway through which a rapport can be established and maintained by the physician. In managing a patient, advising is usually needed on the following: clinical diagnosis, need, nature, and results of a paraclinical diagnostic procedure, pre-treatment diagnosis and objectives of treatment, selection of treatment, outcome of treatment and prognosis, and lastly, health restoration and maintenance after treatment. The following are tips in advising. Always include the relatives of the patient in the advising if they are available. Assess the psychological makeup, the health beliefs, and the level of competency of the patient and the relatives before making any advice. Make strategies that will promote rapport. Be honest but not brutally frank. For example, slowly divulge the diagnosis of an incurable disease or a frightening disease. Use terminologies or explanations that can be easily understood by the patient and his relatives. Use all kinds of strategies that will make the patient and his relatives like you. Explain to the patient and relatives the processes you use in arriving to a diagnosis, recommendations for a paraclinical diagnostic procedure, and treatment. I will end this pep talk at this point. Advice to patient process. The takeaway in this pep talk that are related to the patient empowerment. Understand the patient management process framework in terms of what and how the physician should advise patients and relatives. Be ready to ask questions if the patient is not advising you properly and adequately. Participate actively and fully in the problem solving and decision making of your health concerns with your physicians by first listening, then analyzing their given advice, and then decide. Master the advice topics that you need to hear in each step of the patient management process, as they may help you in some way in deciding for your own health concern and how to problem solve and do decision making, particularly when there is no health care professional around to assist you. This is one other way of gaining greater control on your health concerns and issues. So with that, I end my pep talk entitled Patient Management Process, Advice to Patient Process. I hope I have empowered you to have a better understanding of the advice to patient process in the patient management process. With that, I say thank you for your kind attention. Mabuhay kayong lahat.